Now, South Africa has a significant challenge with a shortage of registered donors and diversity among donors. Experts in stem cell research and donor registries are in Cape Town this week as part of the International Donor Registry Conference. Among the topics being discussed this year will be the role of AI as well as other similar technologies in registries as well as transplant, donor recruitment and selection, and even stem cell processing as well as selection. Let's now welcome Dr. Charlotte Ingram, who's the CEO of the South African Bone Marrow Registry and Medical Director. Doctor, a very good afternoon to you, and thank you so much for joining us. So, stem cell donor, and I suppose the information around this very topic is quite scarce, unless, of course, you have to have a donor yourself, or a family member or relative actually needs a donor. Why do you think this is, particularly in this year where technology as well as ease and access to information is quite regular?
Hi, Alicia, and good afternoon to the viewers. I think it's been a lack of awareness, and I think it's events like we're having now that actually raise that level of awareness. We had this very special evening last night where a donor and patient met for the first time. And I think that brought home to people, it's those incidents that bring home to people the meaning of a stem cell bone marrow transplant and what it means to save a life. And that, I think, has not been out there as much as it should have been. I think things have changed. I see our registry is growing. What I also see is that the demographics of the South African Bone Marrow Registry have actually improved. From a point of view of the previous very low percentage of Black versus Caucasian whites, and also very low percentages of our mixed race, which is very important because the chance of you getting a donor that matches you is also dependent on your ethnic makeup. And that's why it's so important to have a representative registry in the country that represents everybody in the population.
You know, Doctor, I was just about to say that. Firstly, I mean, noting that bone marrow extraction is actually a very complicated process, as you've mentioned, in matching certain DNA. But I wanted to ask, just on the back of what you said in your closing remarks there, what are some of the biggest misconceptions about being such a donor, especially here in South Africa, where we know that some cultural as well as socio issues are the basis of most such decisions? So what are you doing to try and convince these people to actually get the relevant information so that they can actually subscribe to being part of the donors?
So they can actually go online to www.sabmr.co.za and they can actually register to donate. And it's not that difficult. All it is a little cheek swab that you rub in your cheek, and we get the DNA from that. Once you registered on the database, we can put your tissue type into the database to match if a patient needs a match. And using algorithms and technology, we can look for a match for you. So you can actually register online with the Bone Marrow Registry. And we will even send a swab to you and collect the swab. So it's a definite. People should not be aware. There's a lot of information on our website as well to explain who can be a donor, because we want healthy donors for our patients, and younger donors are also very important, and we are seeing them come forward, but we need more people to come forward. And it's events like this. I mean, we've got over 300 delegates from 47 countries here, all sharing expertise, all sharing knowledge. We had a patient donor meeting that's going to raise awareness. I mean, you can save someone's life by being a donor for them. And it's a very simple procedure. It's similar to donating blood now. We simply have to put a needle into your arm, extract they take your blood, they separate it out, we keep the stem cells, we give you back all your blood, and then you leave the hospital. It takes a little bit of time, about 4 to 6 hours to do the collection. We don't drill into bones, and very rarely do we actually use actual bone marrow. And if we do, it will be under general anesthetic, and the donor has to agree to that. We ensure that our donors are very much aware of what is going to happen, and they sign consent before they donate. We reconsent them if they match, because there's a 1 in 100,000 chance that you might be actually a match for a patient. So the fact that you register on the registry, you may never be called up, or you may be called up tomorrow. The chances are just there. And as I say, there's a lot of information.
A lot of information indeed, Doctor. I know you mentioned the process of course, registry, but what are the actual requirements to be such a donor? I know you mentioned you're looking for more young people as well as diversity within the sector, particularly in the bone marrow as well as other organs. What qualifies one, and also the process that they will undertake before actually being certified?
Okay, so they actually have to be generally in good health, and there are certain criteria that we would defer them and not want to use the donor for, mostly for their own risk, because we want to make sure that that is a healthy donor. We don't want to harm our donors, neither do we want to harm our patients. So we do initially just the tissue typing, but if you are a match, we will do full testing, similar to what we do for blood, excluding infections that can be passed on to the patient, medical conditions that might put you at risk if we do a collection on you. And those are, if you go onto our website, we actually have a list of who can be a donor and who cannot be donors. And when you go online, it will automatically, when you start to answer a few questions about general health, it will actually kick you out and say, apologies, but you have been deferred, but we will also follow up with a call to that person, just explaining the situation.
And in closing, Doctor, very quickly, we understand the conference will also be looking at AI technology. I know you mentioned this interesting aspect of even using algorithms, meaning technology is fast improving and growing. So talk to us about that. How will looking at AI also assist the sector? I know we have seen some medical devices or even organs being produced through other means in places, in areas especially where there is quite a lack in a number of actual donors.
Yes, I think that will come, but we're not there yet. We still rely heavily on our stem cell donors for the stem cells at this point. And as I said, they have to be a match. The AI part, these are ethical issues that need to be taken into account, and we are busy looking at those. And the World Marrow Donor Association, which is WMDA, which is the meeting that coincides with this International Donor Registry meeting. Actually, there was a poster even on what we should be considering from an ethical point of view, and there's going to be guidance coming out from the World Marrow Donor Association on it. So we're definitely looking at that, because we use search engines to find a match and to interpret the probability of finding a match in a certain registry. And we have only 78,000 odd donors on our South African bone marrow registry. So we are calling everybody to come forward and become donors, but with WMDA and with technology, we link into over 41 million donors, and we will try and find a match in that 41 million if we don't find one for you in South Africa to save your life.
Doctor, thank you so much. Please continue with the great work, and thank you for your contribution this afternoon, and best of luck with the upcoming conference. That is Dr. Charlotte Ingram, the CEO of SA Bone Marrow Registry.